Hi everyone, my name is Daniela Lisa Panesanton, and today I will talk about clinical assessment of peripheral arterial disease of the lower limbs. Contents, definition, application in medicine, pros and cons, ease of apply in Ecuador, and conclusion. Clinical assessment of peripheral arterial disease of the lower limbs. Definition. Peripheral arterial disease is often asymptomatic with only half of all patients displaying typical symptoms, making a diagnosis by other means and tools necessary. There are several currently in use with difference in patient investments and scope, making some more appropriate than others for a specific group of patients.
In peripheral artery disease, or PAD, fatty material called plaque builds up inside the arteries that supply blood and oxygen to your legs. The plaque can reduce the blood flow, so the muscle cells in your legs don't get the oxygen they need, causing pain and cramps. Diagnosis of PAD starts with a physical examination. Your doctor can check for a weak pulse in your legs and whooshing sounds called bruit, which are heard when they listen to blood flow. Your doctor may recommend an ankle brachial index, or ABI. An ABI compares the blood pressure in your ankles and arms. An ABI is done with a regular blood pressure cuff. A handheld ultrasound device called a Doppler lets your doctor listen to blood flow. Normally, the pressure in the ankle is the same or higher than the pressure in the arm, and the index is around 1. As PAD becomes more severe, the index number becomes smaller. ABI may be done if you have symptoms of PAD, like leg pain brought on by walking. But since PAD often causes no symptoms, ask your doctor about ABI if you are over 50 and have risk factors, which include smoking, diabetes, overweight, high blood pressure, or high cholesterol. Your doctor may also recommend other tests for PAD. These can include imaging tests such as an ultrasound, MRI, or a CT scan of the arteries in your legs.
Application in medicine. A standard clinical examination of patients with suspected PAD can provide a lot of pertinent information, such as family history and inclusion in the risk group, but it has insufficient diagnosis value in itself. Fortunately, there are several diagnostic methods that can collect accurate information about the presence and severity of the disease, but clinicians should differentiate their application and be aware of their advantages and limitations.
The road to a healthier life begins right here from one of America's most respected names in medicine, Henry Ford Health System. This is Healthy Living at Henry Ford West Bloomfield Hospital.
Hi, Jimmy Rhodes here with Nicole Kennedy, who's a vascular surgeon here at Henry Ford West Bloomfield Hospital. And Dr. Kennedy, I hear this term PAD, but I don't know what it is. What is it and who gets it?
Jimmy, PAD stands for peripheral arterial disease. That's hardening of the arteries or blockages in the blood vessels that go from the heart down to the toes. Anyone can get it, usually builds up over many years. People who are especially at risk are people with heart disease and risk of stroke.
Okay, and we have a question from our audience. Go ahead.
Yes, sometimes when I'm walking, my legs cramp. Do you think I have PAD?
It's possible. We treat something called claudication, that's cramping in the legs that occurs after you've walked a certain distance, feels better after you rest for a few minutes. That can be a hallmark of PAD, and you should see your doctor about it.
Okay, what can we do to prevent PAD?
Taking your medications, following with your doctor, exercise, avoiding smoking, doing the right things.
Okay, general health. And what about treatment once you have it?
It can be from a very simple medication all the way to a surgical procedure involving balloons and wires, sometimes even an open bypass surgery.
Okay, and they need to consult with someone like you to find that out.
We're here for that.
Okay, fantastic. You can find out a whole lot more by visiting the website. Go to wxyz.com/Henry Ford. Doctor, thank you so much.
For more on today's Healthy Living from Henry Ford West Bloomfield Hospital, go to wxyz.com/Henry Ford.
Pros and cons. The advantage of a correct evaluation is that it will allow to know the severity of the disease through the signs and symptoms of limb ischemia, through the physical examination and the use of CT, duplex ultrasonography, computer tomography, and magnetic resonance angiography. The negative part of this process is minimal because it is a very necessary process for an early diagnosis, and contraindication or life-threatening conditions such as DVP, phlegmasia, or necrotizing fasciitis should be considered.
We have a graphic of risk factors that you should be looking out for. Doctor, let's go over those. He is walking to our 3D image wall. And obviously, history of smoking, doctor, that's common sense. Diabetes, advanced age, high blood pressure, excess weight, a family history of PAD, and high cholesterol. Is it one of these, or would you say it's all of these?
I think it's all of those.
Okay.
All of those play a critical role in the development of peripheral arterial disease. If I had to choose two major risk factors, and diabetes is one of them, without question. Diabetes is a major risk factor, and smoking is another major risk factor. Those two are, to me, in my opinion, the most common causes or the most important causes of developing peripheral arterial disease. So what we have, you wanted me to go
Yes,
into the
I'd like you to
graphic?
show our viewers, obviously we have the lower limbs there, and what's happening.
Okay, so what we're showing you here is the circulation in both lower extremities. And what you're seeing is, this is the main artery, femoral artery, superficial femoral artery, giving the blood down to the lower legs. When you have a blockage in this area of the artery, it inhibits the blood flow or the oxygenated blood to provide the much needed oxygen to those exercising muscles.
Okay.
So this is similar to a condition known as angina pectoris or angina in the heart. The heart is beating. There's a clog of atherosclerosis, one of the arteries. Not enough blood gets there. The patient has chest pain. This is exactly the same thing.
Okay.
So the patient is walking, the muscle is contracting, needing more blood flow. The patient stops. The blood flow, whatever little may be getting there through collaterals, catches up with the exercising muscle, and the discomfort goes away.
Is applied in Ecuador. Peripheral artery disease is the most common non-cardiac artery disease in the world. Patients with type 2 diabetes mellitus have a 2 to 4 times higher risk of developing the disease. Therefore, according to the high rates of diabetes in Ecuador, the risk of presenting peripheral arterial disease is high. In addition, according to WHO projection in 2030, diabetes will represent the 7th leading cause of death. This indicates a high risk of disease prevalence.
Heart disease is the #1 cause of death in the U.S., but what many people don't know is peripheral artery disease often goes hand in hand with heart disease.
Most people that have coronary disease, meaning a buildup of plaque in the arteries of the heart, will have plaque buildup in other parts of the body.
Peripheral artery disease, also known as PAD, means there is plaque buildup in the arteries causing them to narrow and harden. This can cause circulation problems and reduce blood flow to the arms and legs.
When it happens in the arteries of the heart, it's called coronary artery disease. When it happens in other parts of the body, for example, if it happens in the arteries of the leg, arteries of the arm, arteries of the neck, then it's called peripheral arterial disease.
But there are many things patients can do to prevent PAD, like stop smoking, control your diabetes, high cholesterol, high blood pressure, and monitor your weight.
The treatment could start with simple approaches such as exercise programs and such as medications.
Patients with PAD may have non-healing wounds on their feet or pain in their legs and feet. If the symptoms get worse, patients are at risk for a heart attack or stroke.
You've got to be a little bit more vigilant about your symptoms. So if you, start developing chest pain, pressure, tightness, shortness of breath, then you may want to seek medical attention. If you're having exertional pain in your legs, meaning you walk and you all of a sudden experience pain and you rest and the symptoms go away, you may want to focus and get medical attention for that.
Making lifestyle changes now can prevent PAD and ultimately save your life. For Lee Health, I'm Lindsay Fry.
Conclusion. Peripheral arterial disease have diabetes mellitus have the main risk factor. Therefore, they cannot be separated at the time of the study. It should be borne in mind that the clinical evaluation is a very important step for its correct diagnosis and management, for which it is important to know all those involved in the procedure. Thank you.